Hi, I'm Anthony O'Connor. I'm a licensed acupuncturist and herbalist, and today we're going to ask the question, is Chinese herbal medicine safe? In 2019, the World Health Organization came out in favour of herbal medicine, and you would think that would be the end of it, but if it were, this would be a really short video. There's a really interesting phenomenon where the World Health Organization is considered to be the ultimate arbiter of all global health advice until they advise on using Chinese medicine. Then they immediately become dangerous and misguided. A lot of these same articles also put forward this kind of related viewpoint, which I find really interesting, which is that herbal medicine does nothing until it kills you. It's either completely ineffective, no clinical efficacy, placebo, or it's going to kill you stone dead, which is an amazing spectrum of attributes for any compound to have, to be either ineffective or fatal and have no therapeutic use whatsoever. But that's the assertion a lot of these guys make. So why are so many people so scared of herbal medicine? And what do the writers of these articles think they know that the World Health Organization doesn't? Well, it's actually very simple. They're trying to evaluate herbal medicine using the tools we use to evaluate pharmaceutical medicine, and that doesn't work. Pharmaceutical medicine and pharmaceutical trials are based on the concept of the API, the active pharmaceutical ingredient. Basically, pharmaceutical trials want to test a single intervention, the effect of one and only one isolated chemical compound on the human body. The reason herbal medicine seems so frightening is because every single herb contains a myriad of individual compounds, all having an effect on the human body and on each other. The API model can't analyze that kind of intervention very well. And because it can't handle it very well, it seems very dangerous to people whose only familiarity with evaluation comes from this model. But it isn't, for several very simple reasons. We prescribe formulas, which are combinations of herbs, and what that means is that while the overall dosage can be quite high, the dosage of each individual herb is actually quite low. Our formulas are designed to be internally balanced, and what that means is that we preempt side effects, and we preemptively include herbs to mitigate these side effects. Paoja, which is the practice of preparing herbs. Even our very oldest texts have very, very detailed instructions on how to prepare herbs to maximize therapeutic effect and minimize toxicity. The therapeutic range of herbs. So basically, when you take a compound, there's a certain dosage where nothing will happen, there's a certain dosage where it'll have a therapeutic effect, and there's a certain dosage where it'll have a toxic effect. Contrary to the assertions from the articles I mentioned earlier, the therapeutic range of herbs is actually very, very broad. Compare this to the therapeutic range of pharmaceutical medicine, you'll see it's actually a lot narrower. So if there's a medicine out there that goes from being ineffective to toxic quite quickly, that description is actually better applied to pharmaceutical medicine than herbal medicine. Our formulas are time tested, and while this is a really easy phrase to throw around, a lot of our common formulas derive from texts like the Shanghan Lun, which is 1,800 years old. So medicines don't hang around that long unless they're really working. The way we prescribe is also different. Most herbal formulas are designed to be taken for days, weeks, or months. We're not handing somebody a formula, telling them to take it every day for a year, and then pushing them out the door. Our patients take our formulas for a week or two, then they come back and they get re-evaluated. At that point, we might continue with the same formula, we might modify it, or we might change the formula altogether, depending on the patient's presentation that day. So, people that judge herbal medicine based on the API, the pharmaceutical research model, will perceive it as being very dangerous. People that study it and know how to use it, like myself, will perceive it as being incredibly safe. So who's right? Well, let's look at the statistics. Before I jump into the herbal medicine stuff, the first statistic I want to share with you is a bit of a grim one. 1 to 2,000 deaths per year. That's how many people die from NSAID use in the UK annually. So that's what the yearly fatality rate is for a very common class of pharmaceuticals just in the UK. Now let's take a look at some of the figures associated with herbal medicine. Between 1968 and 1997, the World Health Organization reported only 8,985 adverse events of any kind related to herbal medicine use. Most of these adverse events related to single herb use. Combinations of herbs, which is the type of herbal medicine that Chinese herbal medicine practitioners use, was responsible for only 368 adverse events worldwide in almost 30 years. Some critics have claimed that adverse events from herbal medicines are underreported, but a Canadian study examined this, and what they found was that adverse events from herbal medicine are actually far better reported than adverse events from pharmaceutical medicine. And when you think about how the medicines are used, this actually makes a lot of sense. If I give one of my patients a herb and it makes them sick, you can be sure I'm going back to my supplier. That's my reputation on the line, and I'm going to make a lot of noise and a lot of complaints. Likewise with health shops, if they sell their customer a product and their customer gets sick, well, firstly, they're going to have to issue a refund. They're not going to be happy about that, and they're also going to be going back to their supplier with a complaint. Compare that to Western medicine, where, for example, your GP might give you an antibiotic to help with your chest infection. If you go back and tell them it's after upsetting my stomach, their response will usually be, yes, that's what it does. In fact, less than 10% of adverse events resulting from pharmaceutical use are reported at all. And just to be clear, this is not an attack on pharmaceutical medicine. Pharmaceutical medicine is a powerful and vital tool. What I'm trying to highlight here are the vastly different standards that are applied to Western pharmaceutical medicine and Chinese herbal medicine. And all this is not to say that herbal medicine is without its dangers. The World Health Organization approved the use of acupuncture in 2003. It took another 16 years to approve the use of herbal medicine. And the reason for that is herbal medicine does carry additional risks. Herbs can be adulterated or contaminated, they can be misprescribed, or they can interfere with prescription medication. Any of these issues can cause serious health problems. The vast majority of adverse events relating to herbs come from unlicensed practitioners using the herbs incorrectly. And that's why it's vital that herbal medicine is always prescribed only by a licensed practitioner getting their herbs from an approved supplier. But when these basic precautions are taken, herbal medicine is, by any metric, incredibly safe. It's also not a case of one or the other. Most hospitals in China will have two pharmacies on the ground floor, one for herbal medicine and one for pharmaceutical medicine. In Japan, herbal medicine is prescribed by 70% of MDs, and it's available over the counter in most pharmacies and supermarkets. It requires special skills to be able to combine pharmaceuticals and Chinese herbal medicine, but it can be done and it can be incredibly effective. But working together requires communication and understanding, and right now the hostility being directed towards Chinese herbal medicine is completely disproportionate to the risks associated with it. That's all for this episode. If you have any questions or suggestions for future topics, please leave them down in the comments below. As always, thank you for watching.